Good evening. My name is TessaO'Dea and I'm going to present my assessment task titled From Clinical Leadership to Operations Management, 5 Lessons Shaping My Management Practice. So when I commenced this unit, I wanted to better understand how its concepts applied to public healthcare and specifically to my role leading workforce operations and innovation in a physiotherapy department in the Allied Health Division at Austin Health. This presentation reflects on 5 key concepts I expected to learn and how they will shape my management practice. So lesson 1, healthcare is an operation that can be deliberately designed and improved. What I expected to learn was what operations management is and how it applied to service organisations rather than those producing physical products. What I learned was in healthcare, operations are the people, processes, resources, and systems used to deliver patient care. Performance is measured not only through productivity and cost, but also through quality and effective resource use. Together, these factors influence patient access, safety, outcomes, and experience. The unit helped me recognise, particularly through use of approaches such as TQM, that poorly designed or inconsistent operations can create variations in care. The variation affects not only efficiency and cost, but also the quality and reliability of the service patients receive. How this will shape my management practice, I will focus less on reacting to individual problems and more on understanding, designing, and improving reliable systems that create value for patients and the organisation. So lesson 2, performance depends on the entire value chain. I expected to learn about supply chains and inputs and outputs and capacity management. And I was initially uncertain about how supply chain concepts applied to public healthcare. What I learnt was that healthcare operates through a complex network of internal and external suppliers, resources, processes, and customers. The unit helped me recognise that public healthcare does have a supply chain, although it is less linear than a manufacturing supply chain. Patients are not products. They're both customers and active participants in the care process. Demand is really also uncertain, and healthcare outputs must be assessed through quality, safety, and patient outcomes, not just volume or efficiency. In my workplace, these concepts are visible in the department's daily workforce challenges. Patient referrals represent demand, while staff time and capability represent capacity. So, as an example, variation in our new graduate staff work preparedness demonstrates how the quality of an upstream supplier input, i.e. university education and clinical placement experience, can affect downstream supervision requirements, workforce capacity, and consistency of patient care. How it will shape my management practice is I'll take a more end-to-end view of services using frameworks like lean management and avoid assuming that problems belong only in one team. Lesson 3, technology is an enabler of improvement, not the improvement itself. I expected to learn about Industry 4.0, digitalisation, and how emerging technologies are changing organisational operations. What I learned was that across successive industrial revolutions, there has been a creation of major improvements in productivity. And this holds true to Industry 4.0, which is associated with technologies such as AI, big data, connected systems, automation, and the Internet of Things. In healthcare, these technologies have huge potential to improve care for patients. However, I have learned that digitisation is not automatically operational improvement. Technology can reinforce an inefficient process if the underlying workflow problems have not been addressed. And so digital solutions in public health can also introduce challenges involving system interoperability, data quality, privacy, cybersecurity, staff capability, and change resistance. The learning has informed my proposal for an integrated physiotherapy performance dashboard. The dashboard will bring workforce activity quality, patient flow, and financial information together into one location. However, it's increasingly clear the value will not just come from the dashboard itself, but the value comes from managers and teams using the information consistently to identify variation, make decisions, and initiate improvement. How it will shape my management practices, I will continue to be excited by the technologies of Industry 4.0 and even the emerging Industry 5.0, but recognize improvements will and should consider digital and non-digital improvement approaches. Lesson 4, operational excellence is shaped by organizational context. What I expected to learn was, I expected to understand the external forces of change affecting organizations and why organizations must continually improve to remain relevant and effective and sustainable. I learned that organizations are systems influenced by pastel factors, including political, economical, social, technological, environmental, and legal. And in public healthcare, there are significant external forces of change, including things like increasing clinical demand on and patient complexity, an aging population, and greater prevalence of chronic illness, workforce shortages, financial and funding constraints, health policy, and regulatory requirements, and many more. The application to my workplace means understanding the niche forces of change that apply to my organisation and or the strategic business units doing improvement in response to operational challenges. So I will take a more deliberate environmental scanning approach and consider external pressures when developing workforce and service improvement plans. And further, rather than designing rigid systems based on stable conditions, I will aim to build adaptable systems that can respond to evolving healthcare landscapes. Lesson 5, strategy only creates value when it is translated into operations. I expected to gain an understanding of why an organization's operational strategy must align with the broader business or organizational strategy. What I learned is that strategic alignment means that an organization's resources, processes, measures, improvement activities, and workforce capabilities all support the overall priorities. In healthcare, this means there should be a clear line of sight between the health services strategic objectives, allied health and physiotherapy priorities, local stream and team objectives, operational processes and workforce decisions, and the measures used to monitor performance. Without this alignment, staff may be working hard and services may appear productive, but their activity may not contribute to the organisation's most important objectives. The application to my workplace, again, is shown through my proposal for a performance dashboard as a mechanism for strengthening strategic alignment. Identifying key KPIs should and will connect to measures relating to people, clinical care, patient outcomes, operational performance, and responsible resource use. How it will shape my management practice? This will be by remembering and choosing strategy in times of high pressure decision making. As a leader, it's my responsibility not to get stuck down in the weeds, but stay focused on strategic direction and ensure operations are aligned to this. Final slide. My conclusion, the most significant change resulting from this unit is that I now see operations management as central to healthcare leadership. These lessons have shifted my management approach from responding to individual operational problems towards designing connected, evidence-informed, and strategically aligned systems, ultimately with a view to create value for patients, staff, and the organisation. Thank you very much.